Welcome, everyone. Once again, it is 4:02. So Dr. Phoenix, I'm going to hand it over to you so we can get started. Thank you.
Good afternoon, everyone. I'm Janet Phoenix. I'm a senior consultant with the Grant Group. I'm here today to conduct the presentation. I'd like to introduce my colleague, Sydney Robinson.
Good evening, everyone.
So very happy to have an opportunity to talk with you this afternoon. We're going to walk you through some considerations as you are moving through the process of reopening. I certainly understand that some programs have been operating despite the pandemic. So for those of you who have already reopened, I think this information will still be useful. We've been able to, again, pull information, some of the latest information from CDC and other credible sources, and pulled it together to really try to make it accessible for you so that you have some information that you can use as you're making decisions about what things to change as we move a little bit further into this period. Next slide, please, Sydney. So let me say that the slide presentation, as all of our previous training materials, will be available on the Primary Care Coalition website. Some of you have attended the trainings that we've done in the past. We started off talking about personal protective equipment, and then we did one that was broad, talking about infection control prevention procedures, and then we talked more about vaccination as we got to the point where vaccines were becoming available. So all of that information, the recordings and the slide decks, are available to you on the Primary Care Coalition website, and this presentation will be uploaded within a few days. So you'll be able to view the recording again. You can have folks who are working with you view the recording if they would like the information, and the slide deck will also be available. You can download that and share it as well. Today, we'll be talking briefly about some of the latest vaccine updates. I think what's on everyone's mind is the work that's going on to tease out what may have caused some some unpleasant developments in terms of the Johnson & Johnson vaccine. So we'll begin the presentation by giving you a vaccine update. Then we'll move into what are really not so much a criteria as suggestions that you can use as you're thinking about lifting restrictions, changing some of the ways that you operate. We'll talk about outdoors and the positive role that we think outdoors can play in keeping us all protected as we move further down the road and more people are getting vaccinated. But with the weather warmer, encouraging a lot of activities to take place outside if possible. We'll talk about testing and the continued role of testing. We'll talk about travel and what CDC is recommending in terms of travel, both domestic and international. The last two sections will be on vaccination status and transportation. I know it sounds like a lot of topics, but we will get through this in time for you to be able to pose some questions at the end and for us to have some discussion. Next slide, please. So let me first say that some services for people who we support with intellectual and developmental disabilities are being conducted on site in facilities. Although this model for providing day services is a model that's been decreasing over time, there are still some services that are being provided in congregate settings. And if that is the case, then of course those same considerations need to be taken into account in terms of 6-foot distance, in terms of cleaning and disinfecting surfaces, ensuring that everyone who's inside who's receiving services is wearing masks. So all of those infection control measures that we've been implementing for many, many, many months, we need to continue doing if services are being provided inside facilities. Next slide, please. But in many cases, we are assisting people who are employed in the community. And in that circumstance, we really need to be mindful of what the procedures and recommendations are in place at those work sites. And so that's going to vary depending upon the site where people are working. If they're working in a grocery store, for example, then there are going to be some restrictions in place in terms of wearing masks or some kind of face protection, about sanitizing frequently, about cleaning surfaces. So it's important, whatever setting people are employed in, that we are familiar with what those requirements are for that setting, and that we can assist the people we support to make sure that they follow those recommendations and that they're able to follow those recommendations. So some helpful tips in that circumstance might be to allow, to assist people to organize the things that they might need to keep on hand to be able to comply with recommendations in that workplace, whether it's a mask, whether it's hand sanitizer or tissues, other kinds of things that they might need, to make sure that they have the ability to have those things on hand so that they can continue to meet the requirements of their employer. Next slide, please. And then sometimes we are going into community settings to transport people to activities or perhaps to provide some services in their homes. And again, we need to be mindful of the setting. We need to be mindful of people who are going to be interacting with us in those settings and who are going to be interacting with the people we support. So it's important to kind of keep asking questions about vaccination status, about exposures, about high-risk behaviors, so that everyone can stay safe in whatever setting they're in. And I think it's also important to recognize that staff may be moving from different setting to different setting. We certainly know they're moving from their home environments to work environments, but it's possible that some staff may be working on the residential side, in a group home, as well as working in a facility and providing employment services or other kinds of services to the people we support. Next slide, please. So the vaccine update. I'm sure most of you have heard about the pause. We are still waiting to hear when the pause might end, if the pause might end, but it's a very similar situation to what happened in Europe with the AstraZeneca vaccine. There were reports, a small number of people out of the 7 or 8 million people who received the J&J vaccine developed a rare blood clot syndrome, a very atypical blood clot syndrome. It involved multiple clots. It involved clots in the brain, not your typical blood clotting syndrome. And so because it was so unusual, it was possible for CDC and the Food and Drug Administration to be able to link this to the vaccinations. And so the responsible thing was done. They paused and stopped administering these vaccines. So I think that for all of us, it's a concern because we've been trying to encourage vaccination, recognizing that a lot of people are nervous about getting vaccinated. And this is likely to contribute to that nervousness. And for some people, it may cause them to reconsider a decision they may have made to get vaccinated. Which is an unfortunate thing. I think that this really is an indication that the system for identifying what's called adverse events, and what basically means anything that happens after you take a medication, however you take it, whether it's injected or whether you swallow a pill, that system of identifying adverse events in people who may have had a medication or a vaccination is working. It was working well enough that they were able to detect these 6 or 7 cases out of 7 million people who had been administered this vaccine. So in a sense, it's an indication that the system is functioning in the way that it should. Next slide, please. Next slide, please. So I want to just, kind of go over the time frame and go over what the symptoms were for the people who experienced these unfortunate results from the vaccination. So as early as 6 days after vaccination, or as long as 3 weeks. So that's kind of the window. Initially, people experience symptoms such as headache, tiredness, chills, fever, difficulty breathing. And then as time progressed, they had severe headaches. Some people experienced left-sided weakness, vomiting, swelling of the lower legs, and severe abdominal pain. So we are, kind of getting to the point now, the pause has been in effect long enough that it's unlikely that we will continue to see people emerging with this pattern. Next slide, please. And the next step is that the data is going to continue to be reviewed. They're already beginning to characterize what happened to the people who experienced these symptoms and signs. And I think we'll have a recommendation soon about whether it makes sense to proceed or whether we'll continue to rely upon the Pfizer and the Moderna vaccines here in the US. Next slide. The good news is that we do have a large enough vaccine supply. Things are really getting better in terms of the availability of vaccines. And we've also opened up the age range in a number of places, gotten it down to 16 at this point, so that, eventually we're hoping once the childhood vaccine trials are complete, that we'll be able to even vaccinate people who are younger than the age of 16. So we have a short video here that we'd like to show. So I think the take-home message from CDC is that as you, if you're vaccinated, and if you have completed that 2-week period after your second shot, if you're getting the Moderna or the Pfizer vaccine, or 2 weeks after the J&J, then you're considered fully vaccinated. And there are enough people now who are fully vaccinated that, this is why we're really talking with you today about reopening, about relaxing some of the restrictions. But we're in a lot of different stages. I think there's probably not a single workplace where you can say you have that 100% of the people you work with are vaccinated, or 100% of the people who you're providing services for are vaccinated. And so it becomes kind of challenging as you're managing to really be able to figure out what can we do, what can't we do, and to even keep track of the statuses of everyone who you work with. But I encourage you to make the effort to track staff and the people we serve, so that you have some sense of what those vaccination rates are. Because, we have some benchmarks, if you will, in terms of when we think enough of a population is protected, that the virus is probably not going to be able to circulate easily. So at the community level, that benchmark is somewhere between 70 and 90%. And so you may want to use a similar benchmark within your facility. Once you get to the point where 70 to 90% of your staff and 70 to 90% of the people you work with are fully vaccinated, then perhaps you're at the point where you can really feel that the virus will not circulate easily. and that you are pretty protected. But we're not at that point yet. I think the other data point that you want to be able to look at is the county positivity rate. And part of, a rate of less than 5% is what is recommended as a low level of transmission. And a higher rate above 10% is considered a high rate of transmission. So I'm getting a lot of messages. So I think that there are people who are posing questions who perhaps would like to have those questions answered now. Is that what you're asking, Timmy, for me to pause and perhaps take a couple of questions now?
Yes. Jessica, do you mind reading the questions in the chat, please?
No problem. Give me 1 second. Okay. Okay, I see them now. Okay, my first question for you, Dr. Phoenix, would be, how can we prepare people who we support who are working in community settings?
So some of the suggestions that I made earlier, I think would be very helpful, is to familiarize yourself with what the requirements are for the setting where the people are employed. And that's, again, it's going to vary from setting to setting, but to really to have a good understanding of what the expectations are, so that you can assist the person who you're supporting to be able to meet those requirements. The backpack strategy is just a suggestion, because sometimes it's just helpful to have everything you need in one place that's accessible. Your mask, your hand sanitizer. Some workplaces require gloves, so having the gloves handy. Whatever it is that's needed, whatever the expectation is. And then I think practicing modeling. So before they go to work, if this is a new work setting, for example, before they go through kind of an exercise where people can practice and so that they're comfortable, so that when they get to the workplace, they know what to expect. So those are some suggestions that I would make. Next question, please.
Thank you. Okay, here's another one. What is the current recommendation on cleaning? CDC says soap and water. Is that adequate? When is cleaning critical? With changes, what does that mean for us? Clean after each trip in a car, still clean periodically when in the building. What are your ideas on cleaning?
So we're going to talk about cleaning in the vehicle a little bit later in the presentation. So I'm not going to respond to that question just yet, but I'll get to it. In terms of cleaning the buildings, let me just preface this by saying that all of these recommendations have been modified over time. We're not doing things in the same way that we were doing at the beginning of the pandemic, in part because we've learned things as we've gone along. So in the beginning, I think there was a lot of fear about the virus being transmitted from surfaces. So what, I think the technical term is fomite transmission. Because in a laboratory setting, they were able to demonstrate that the virus could live on surfaces and could live on surfaces for hours. That seemed to suggest that people could get COVID-19 by touching a surface where the virus might be living. As time has gone on, we're backing away from that a bit. Although CDC is still recommending cleaning and disinfecting surfaces, there just doesn't seem to be much evidence that people are getting the virus through touching surfaces. And it's still a good idea to clean. And soap and water will do a good job. If you would prefer to use something stronger, there is a list of recommended cleaners that have been tested and proved effective against COVID-19 on the Environmental Protection Agency site. It's called the EPA-N list. And again, links to that list are available in the infection control presentation that is on the Montgomery County Primary Care website. But even if you just Google EPA-N, as in Nathan, you can find that list, and you can find a list of cleaners and disinfection agents that can be purchased in any grocery store or at Target or Walmart, wherever you do your shopping. And so it is still a good idea to clean, but and it's a good idea to clean, I would say, when there's a turnover of staff. So if you have a shift change, for example, that's a good opportunity to clean. And it's also a good rule of thumb to clean the surfaces that people are touching more frequently. So those would be things like doorknobs and handles. You know, the things that a lot of people are handling on a regular basis are the things you want to focus on. But as I said, as time has gone on, the emphasis on breathing, particle transmission, aerosols, in terms of how the virus is spread, you know, that's the primary route of exposure. And there's very little evidence to suggest that that people are getting COVID-19 from touching surfaces, but it is still a good idea to clean and disinfect. Is there another question?
Yes, thank you, Dr. Phoenix. I have one more question for you.
Okay.
So it says we are exploring air scrubbers on our HVAC systems. Is there guidance on whether or not that would be a good investment for group homes?
So I had an opportunity to visit some of the group homes as we were putting together these educational materials, and many homes were smaller in single family residences. And so the recommendation for those settings would be to focus on your filters, making sure that you have a filter with a high MERV rating. The higher the MERV rating, the better the filter is at filtering out smaller particles. It may not be a good investment to try to completely redo or recalibrate a ventilation system for a single family residence. But for larger buildings, for commercial facilities, it makes sense. I'm not an expert on those systems, but we can certainly work to provide some references for that after this presentation ends. So I think I should probably move on because I know there'll be more questions, and I'd like to be able to get through the material so that you have some time at the end to pose questions as well. Next slide, please. So these are the sites where you can find information about the positivity rate. And we updated this, I believe, this morning, if I'm correct. And so Montgomery County really it's in that range, below 5%. PG County, of course, is pretty close by, and many people are living in one county and working in another. In that circumstance, PG County is a little bit above 5%, but really, not significantly so. And DC is below 5%. So these are some resources. Again, this is a data point that you can use to judge. And again, I wouldn't just look at a single day. I would look at trends to see what's happening over time. Are we creeping up? Or are things kind of stable or are going down in your county? Next slide, please. So one thing we discovered as we were putting together this presentation is that there isn't a lot of material that's specifically focused at day programs. And so we kind of cast a broad net and started looking at other states that are somewhat similar to Maryland to try to find guidance that they may have put together in their disability organizations, state disability organizations. And so New Jersey had, I think, some useful guidance in terms of how to get started and what information would help to guide you as you're planning for changes moving forward. And what they really suggested is reassessing the people you work with. And this would be especially true if you've had a pause If some programs and services have been on hold and you are now really, reopening, then it would be good to kind of reassess, make sure that the data you have about the people you're serving is still accurate. A lot of time has passed. There may have been changes in people's medical conditions, but also to talk with caregivers, the family members, to see what they're comfortable with. What we're finding that people are a little bit slower to reemerge and to start doing things that they have done in the past, because there's still some nervousness about what's safe and what's not safe. So it may be that people are a bit reluctant to jump back into some kinds of activities, and it would be good to have those conversations so that you can plan appropriately. But it's especially important to make sure that the needs of the people you're working with are reassessed, so that you know what conditions they have and what you need to plan for in terms of the programs and services that you're putting together. Next slide. And so this is just a website that New Jersey is using, where the form they're using to collect this information lives at this site. You could take a look at that. That might be something that you would want to adapt for your own purposes. Next slide. So again, New Jersey is suggesting that anyone who's receiving services in a day program be masked, whether they're visitor.
God would answer so many prayers.
Could you mute, please? Thank you. Whether they're visitors or staff, that everybody should wear a mask. Now, of course, some people are not going to be comfortable with masks, are not going to be able to wear masks. So, you have to take that into consideration. But if people can, they should be wearing masks. And frankly, it's also important that if, as you're supporting people, you're engaging in an activity where you might be exposed to bodily fluids, then a higher level of personal protective equipment might be worn. So perhaps a mask, gown, gloves, eye protection. And so information about all of the PPE, how to use it, what order in which to put it on, all of that information is available in our PPE presentation. That was the very first one that we did. And that's available on the website. And for you to use if you need to. So again, hand washing, and if as people enter and leave at the start and finish of activities, and if it's not possible, if things are perhaps being done outdoors, hand sanitizer is a good option, alternative for hand washing. Next slide. Communal dining is still a bit of a problem, because if you're eating or drinking, of course, you can't wear a mask. So if you're in close proximity to other people and not wearing a mask, of course, and not knowing people's vaccination status, then that's still considered a fairly high risk activity. So buffet meals or sit down meals, group dining is still discouraged. New Jersey's actually not permitting that in its state programs. It's something you have to think about how you're going to handle those circumstances. But again, looking at the risk profile of a particular activity and planning for that so that you can provide services in a way that helps to keep staff safe, and also the people who we serve safe is what we're encouraging you to do. Next slide. So screening is still important. So, asking people those screening questions that we've all gotten so familiar with. Have you been exposed to anyone who tested positive for COVID? Do you have signs and symptoms of COVID? Those questions are still appropriate. And even doing things like temperature checks to supplement that is important. And it's important that we continue to do this until we hit that really, really high threshold of about 90% vaccination. And I know we're probably not there yet for most of you. And it's still reinforcing those messages about keeping our social distance of 6 feet if possible. And really trying to do as much as we can in community settings outdoors. Next slide, please. So again, this guidance, these are suggestions. It's not, these aren't hard and fast criteria. We know that you have been making decisions all along that are tailored to your facility, to your staff, to the people you work with, and you've been making good decisions and will continue to do so. This information is really just being provided as a resource to you to help guide your decision making. You may choose to do things differently than what has been recommended here for people working in these states that are not Maryland, but we wanted to present this information for you to think about. So again, the fewer the number of people who are gathering in indoor spaces, the better, because when you have large numbers of people gathering in indoor spaces, then the number of viral particles, if someone perhaps is asymptomatic and infected with COVID-19, the number of particles can kind of build up in those indoor spaces. And ventilation systems vary depending upon the building, depending upon how recently that furnace filter or air conditioning filter may have been changed. You may be in a building where windows don't open easily, or the weather just may not have gotten to the point where it's warm enough outside that you can open the windows and get fresh air circulating. So it's important to, again, still think about fewer numbers of people inside inside spaces and fewer numbers of people in vehicles as we're transporting people to activities or employment in the community. Next slide. Next slide, please. This is the New York recommendations are very similar to what is being done in New Jersey. And I'm going to cover testing a little bit further down. So let's move through this slide to the next one, please, Sydney. Okay, I mentioned outdoors. And again, it's April. When May comes, well, I think we're going to be seeing much nicer weather even than we're having now. I think it got a bit cold this week. I had put my plants out, I had to bring them back in because I was worried about a freeze. But we're going to be getting to the point where it's going to be possible to do a lot of things outdoors. And even if things are being done indoors, opening windows so that you can get fresh air coming in and out is going to be possible and strongly encouraged. Next slide, please. Okay, and again, outdoors is safer, but you'd still want to wear masks if possible, if you can, because even when you're outdoors, you may still come into close contact with people closer than that 6 feet that's recommended. So it's still a good idea to wear the mask and to help the people we work with to wear masks, to avoid crowds and lines. And if you have an encounter during an outing, it's a good idea to have a conversation with the manager about that activity, to encourage staff to have a conversation with their managers about that activity that may have been risky when they come back, so that you can plan for it. Next slide, please. So again, the screening questions are important to ask when people come and go at the start and the finish of activities. These are important. Next slide, please. So for sporting events or physical activities, it's still important to avoid close contact and really very active kinds of sports where you might have to come into close contact with someone who is exercising strenuously. We know that there are more bodily fluids, more aerosols that are given off when you're exercising vigorously. So New Jersey's actually discouraging these kinds of activities for day programs. Next slide, please. So we wanted to give you some tools to really be able to gauge what's a risky activity and what's a less risky activity. This hierarchy that the Texas Medical Association put together is the best thing that I've come across in terms of really listing a lot of the common things that we may do day to day, and telling me and others kind of which ones are believed to be low risk, which ones are kind of in the middle, and which ones are high risk and perhaps to be avoided. Next slide. So at the low end of the spectrum, and again, you'll notice about these things that almost all of them occur outdoors. So, you know, going to get gas, getting takeout from a restaurant, or even grocery shopping is considered fairly low risk. Next slide, please. So then these things, you're a little more active here. We're getting towards the moderate end, moderate range in the risk hierarchy. So, you know, more active activities, a doctor's waiting room, eating in a restaurant, but outdoors. But still, it's an activity where you may be in close contact with others and not necessarily wearing your mask. So that's kind of getting to the moderate risk activities. Next slide. Eating activities where you're eating with other people is moderate risk. And we're going to be doing these things, especially for people who've been vaccinated. You know, the recommendations really are easing about engaging in these activities. But the trick is everyone who's around you, does everyone who's around you have the same vaccine status that you have? If you can answer that question affirmatively, then you can begin to really engage in some of these activities without worrying about it. If you can't answer that question affirmatively, then you should still take precautions. Next slide. And now we're getting towards the high risk end of the spectrum. And most of these activities involve a number of people. So a wedding, a funeral, you know, you're going to be gathering with a number of people in those settings, or physical contact with someone who may not live in your household. Again, those are all on the higher risk end of the spectrum. Next slide, please. And some of the various highest risk activities involve kind of eating indoors at a buffet, gyms, our gymnasiums, recreational facilities are still high risk places. A lot of people gathered indoors, engaged in vigorous physical activity, some of whom may not be wearing a mask, or amusement parks or sporting activities, those kinds of things are highest risk. Next slide. I'm going to try to move a little bit faster. You know, the going to a bar is probably at the very highest end of the risk range, because, you know, people go there to really gather closely with people. Again, you're eating and drinking, so you're not going to be wearing a mask. It's indoors. It's a poorly ventilated space. So you get the idea of what the criteria are for assigning a low risk level or a high risk level. So, you know, the range indoor to outdoor, the number of people who are there, the activity level, those are all factors to take into account. Let's go to the next slide, please. So what I said when I gave this part of the presentation initially, we gave this during the infection control workshop that we did several weeks ago, is that there are going to be times when, you know, we're going to engage in activities that perhaps are going to be a bit riskier. But that doesn't mean that you can't reduce your risk even while you're engaging in that activity that may be more risky than others. So if you're going to go and get your hair done, for example, you can still take some precautions. Sit out in your car and wait until your turn comes. You know, sitting apart from others, wearing the mask and asking the person who is working with you to wear the mask. So these are some ways to mitigate the risk. And I think it's important to share this information with the people we work with, because you don't know what others are going to do when they leave work and head out into the community. And so that behavior that they engage in out in the community affects you, it affects the workplace, it affects the safety profile of the workplace, because they're going to come back and interact with people. So it's important to communicate the information about risk so that people can be careful not only when they're at work, but also when they leave the workplace to go into the community. Next slide, please. Next slide. So let's talk a little bit about testing. And, you know, I think that, again, these are some suggestions. I think people are making decisions about whether to continue with testing. Some have discontinued testing. We were doing a lot more testing a couple of months ago. If you're testing, it's important that the interval be about a week. No more than that. That's what CDC is recommending. And that's really based in part upon how this bug behaves. You know, there's kind of a 5 to 7 day window in terms of the time frame from when you're exposed to when you might develop symptoms. So you're going to want the testing to really be able to catch people, you know, during that interval. Next slide, please. So we've given you an algorithm here that you can use. Again, we've got a mixture of people. Some folks are, you know, adamant about not getting vaccinated. So the recommendations for them are going to be on the right side of this chart. Or they may not be fully vaccinated yet. They're 2 weeks after the second shot of the Pfizer or the Moderna, may not have passed yet. So they may not be fully immunized. They may not have full immunity, full benefit yet from that injection. If you're vaccinated, then the left side of the chart is going to be where you're going to want to look in terms of the recommendations. And testing is mentioned here, but it's an option. So if it's something that, you know, you've kind of made a decision that you have to back away from the testing, there's certainly logistical issues with testing, and also in terms of notification about the tests, but there also the cost is a factor as well. And so some have made decisions to back away from testing. Some are still engaging in testing. I think CDC recognizes that there's going to be a variety of circumstances and that you may choose not to continue to test. But they do recommend testing in certain circumstances, especially if there's been exposure to someone who is confirmed with COVID-19, or if you're showing signs and symptoms. And that's true even for people who've been vaccinated. So, you know, the Pfizer and the Moderna vaccines are coming in at 94, 95%. So that means that 4 to 5% of every 100 people who are vaccinated may not get the full immunity from that vaccination. So it's possible that they could contract COVID-19. They may not be symptomatic. And so you're thinking they're fully vaccinated, they're showing no symptoms. The only way you might be able to detect an infection would be through testing. Next slide, please. So again, we looked at a number of different sites to really try to get some information for you. If the workers who are working in the group home setting, as well as workers who are working in day programs, they're all considered healthcare providers. And so it's the CDC healthcare provider recommendations that we are using to populate the algorithms, the charts that we provided for you, and also the recommendations that are in narrative format here. So really, to put it in a nutshell, because we're getting kind of towards the end of our time, and I want to make sure that we have time for questions. You know, the quarantine recommendations are easing. But if you have people working with you who have not been vaccinated, then you need to still follow those same kinds of recommendations if they become symptomatic, that they're going to need to quarantine for a period of time. Now, CDC recognizes that there may be some staffing issues that you will face. And so there is kind of a mitigation section to their recommendations that will allow people to shorten the quarantine time period if need be because of a staff shortage. So again, take all of these recommendations kind of with a grain of salt. And if you need to make changes, it's appropriate for you to do so if you need to make sure that you have enough staff to be able to provide the coverages that you need. Next slide, please. Fully vaccinated people do not need to quarantine following an exposure, okay? But if they show signs and symptoms, then of course that recommendation would change. Next slide, please. And again, unvaccinated people are still being counseled to be tested if they come into contact with someone, close contact with someone who has been confirmed to have COVID-19. And then that testing should be repeated, because if you're within that first 5 days of exposure and you're tested, then the test may be a false negative. And so a repeat test is recommended just to be able to catch you at the point when there's enough virus circulating that the test could detect an infection. Next slide. Next slide, please. So some things to consider is, of course, the availability of testing, the turnaround time, and the cost. But take into account if you are going to continue with or perhaps implement testing if you're reopening, that you're going to want to follow the CDC recommendation that the interval for testing be no less than a week, and be guided by the level of community transmission as well. Again, go to that Montgomery County site and perhaps to the sites for the surrounding counties to get some information about what's going on around you in terms of community transmission of COVID-19. Next slide, please. This is an algorithm you can use if there's a case, if a worker or someone who you support is confirmed with COVID-19. Next slide. So the travel recommendations, next slide, have been evolving. So we provided you with an algorithm you can use for domestic or international travel. International travel is continuing to be challenging, I think, because if someone travels internationally and they develop symptoms while they're out of the country, getting back into the country is going to be very, very difficult. Or if they are tested and they're test positive while they're out of the country, getting back into the country is going to be very difficult. For domestic travel, for vaccinated people, the recommendations are really just that, take precautions and, wearing a mask, because you don't know if you can still transmit COVID-19 even if you are vaccinated, but the restrictions are much, much less if you're vaccinated. Next slide, please. So again, just another algorithm you can use for domestic travel, international travel. And then I want to talk just briefly about the hierarchy for lodging. If you are staying with people you've been living with all along, if it's a family trip, for example, that's the safest way. It gets a little bit less safe if you're going to be staying, say, in a hotel or someplace where there are people who are outside of your household who you have to interact with. Next slide. And as far as the mechanism of travel, your family vehicle is going to be the safest way, but it gets a little riskier if you're taking public transportation, a train, a plane. And so again, there's a hierarchy of risks that you need to think about. Next slide. Here we have a brief video. let's skip this one. Let's skip this one. Okay, so some things to think about if people have traveled, is just to give yourself enough of a period of time that you can be sure that you haven't contracted COVID-19 when you come back. And this may actually be, these recommendations may be more suited for people to implement in their home environments. But you just want to make sure that if you've traveled and you're coming back to your household and you have not traveled with the other people in your household, that you take some precautions for the first few days after you're back. Next slide, please. So again, these are community recommendations for what to do if you're fully vaccinated or not. Next slide. And the Maryland Department of Health has made recommendations for adult day programs. And this was the closest recommendation that we could find to the kinds of programs that you're operating. And that is a strong recommendation that everyone who receives services be fully vaccinated. This is obviously not a hard and fast requirement. It's a recommendation. Next slide. So fully vaccinated staff, do not need to quarantine after having contact with someone who has been exposed, who has been confirmed with COVID-19, unless they have some kind of an immunocompromising condition. So a chronic condition like cancer or HIV, for example, would be considered an immunocompromising condition, and in that case, they would need to observe a period of quarantine. Next slide, please. And again, you need to have some information about how many people who are working with you have been vaccinated and who have not. Now, when we had the most recent collaborative meeting, there was a lot of concern about not discriminating against people in the workplace who have not been vaccinated. And that, of course, is important. But you do still need to know so that you can be sure that you are providing services in a safe manner, especially for people who we serve who may have not been vaccinated. It's important that you have that knowledge about, what's the percentage of my staff and which people are vaccinated and not vaccinated, because you're sending people into homes, you're sending people in to assist with transportation, to help people get to employment settings. So that information can help guide your plans and your procedures and the policies that you put into place. Doesn't mean that you're telling people that they can't work, but you want everybody to be able to work safely. Next slide, please. So, and it's important to create a plan that alerts people about the availability of testing. It's getting, as I said, it's getting a lot easier to get tested now. So to think about communicating that information to caregivers, to the people we work with, to continue to be sending strong messages that we would really like people to get vaccinated. So that's important. Next slide, please. High-risk exposures may happen. You may be accompanying someone to an appointment. There may be a slip in terms of PPE, or people may be going through an activity or a procedure where there's potential exposure to bodily fluids, and so that's a high-risk exposure. You want to plan for that and have some protocols and procedures in place. Next slide. Transportation is the last thing. I'm going to go through this quickly. Again, if it's a personal vehicle, try to put someone in the back, driver in the front. Even if you have to make more than one trip, try not to put too many people in the car at the same time. Everyone needs to wear a mask. Try to pick people up at the curbside if possible, to stagger arrival and departure time so that people aren't passing one another coming and going. Next slide. It's important to clean. The easiest way to have that happen is to have the cleaning supplies right there in the vehicle. Many of these recommendations are going to be easier to implement if you have a van, for example, as opposed to an individual sedan vehicle. But either way, the cleaning can happen. Focus on commonly touched surfaces. Next slide. And again, if have a conversation with caregivers about the transportation needs, and also, you know, have a conversation about whether they're comfortable having the person who you support be transported either in a vehicle that that you may be providing for transport of people who you're providing services for. So I think that's the end of our presentation. I know we have a few questions.
Thank you, Dr. Phoenix. Yes, we do have a couple of questions. Jessica, if you want to go ahead and get to those questions real quick.
Sure. Okay. So the first one I believe is, if you're supporting individuals in the community, like not in a group home setting, but in their actual home, is there a specific type of mask or shielding? Is a shield on top of a mask better protection? What are your thoughts on that?
So I believe the recommendation for people, healthcare workers who are direct service professionals, is still to wear a surgical mask and eye protection. The double masking, while it's certainly in the community, that can be more protective, that's still not being recommended while people are working. The single surgical mask, you don't want to double up with a second surgical mask, but the combination of the surgical mask and eye protection is what's being recommended currently.
Thank you. Dr. Phoenix, do you have any recommendations for masking in regards to the new variants? Is it kind of just the same?
Yeah, the personal protective equipment recommendations are the same for what they're calling the wild type as they are for the variants. The virus is still transmitted in the same way. It's primarily through breathing in particles, aerosols. And so the mask is a very, very effective way of preventing that, especially if you fit it properly. So not, you know, I see so many people walking around with masks below the nose, which is, you know, you're halfway there, but not 100% there. So it needs to cover the nose and the mouth. It needs to fit snugly. So if you have the same mask that you've been, you know, if out in the community, if you have a cloth mask, for example, that you've been using a lot, it's going to get loose after a while. Those elastic straps are not going to fit properly. There is a way to knot the surgical mask so that it fits more tightly. There's a video that is in one of the presentations that we've done in the past that will show you how to do that knot looping process to make the mask fit better. But the mask is your friend, and if it's properly fitted, it can be very protective against the variants as well as against the original strains of COVID-19.
Thanks, Dr. Phoenix. We have two more questions, and I know we're over time, so this is being recorded, so if you have to jump off, please feel free. Here's the second to last question. If fully vaccinated, do you have to quarantine if you are working less than 6 feet from individuals for more than 15 minutes, or if the person you are with is not masked?
So that's a kind of a multi-part question, but the simple answer is that if you're fully vaccinated, and, you know, which means 2 weeks past your second dose of the Moderna or the Pfizer vaccine, then you are going to be pretty protected against infection, against your getting infected. But the mask prevents, let's say you're in that 5% category who didn't achieve full immunity from your vaccine, the mask will help protect you from infecting someone else. If you come in contact with someone who's exposed, then what you're going to want to do is determine, are you having symptoms? Because that will govern the decision about whether you would need to isolate or quarantine. So I think we're ready for the last question.
Thank you. Okay, last question is, what is the chance of transmitting COVID if all people gathering are vaccinated?
Pretty low. In fact, CDC is saying that we can gather with people who are fully vaccinated. You can have that, that dinner gathering or family gathering, so long as everyone in the group is fully vaccinated. I think the danger is that once people get that first shot, they almost feel as if they have a get out of jail free card, and they're impatient and perhaps will not wait until 2 weeks after the second injection to start socializing and gathering with people. And also, it's not, you may not know what the status is of the other people who are in the room. So it's important to continue to be cautious. It's important to continue to mask in public, even if you are fully vaccinated, because the others around you may not be.
Thank you, Dr. Phoenix. I'm sorry, we have one last question. And this one is from Tammy Snyder. She said, are agencies having staff wear masks and face shields, or just masks, or are they using goggles regardless of the vaccination status?
So the recommendations for the group home setting are that people wear eye protection and a surgical mask, that combination. And I believe those recommendations also hold for people who are working in the day program environment. So you want eye protection, which could be a face shield or goggles, and a surgical mask, a single surgical mask.
Thank you
Thank
so
you.
much.
And again, the slides as well as the recording of this presentation will be available within a couple of days, I think, on the website.
Yes, everything will be on the PCC website. Thank you all so much for joining in. Give us at least until like tomorrow afternoonish is when we'll post it. If you're in a crunch for time and you need it a little bit sooner, just reach out to me. This is Jessica Hairston. Just shoot me an email and I can try to get it to you as soon as possible. Thanks, everyone. Have a great weekend.
Thanks, everyone.
Thank you.
Thank you.
Thanks.